Today we are discussing on psoriasis and the impact on quality of life on all those patients who have psoriasis. And welcome to DermaVidya, comprehensive guide on psoriasis and its profound impact on the quality of life. Now, for all of you, you should remember that psoriasis is a chronic disease. It's like something, what I tell to the patient is that it's something like diabetes. It is something that will stay with you almost lifelong. And like diabetes, which is treatable, it is not curable. Psoriasis is also something which is treatable, but not always curable. And it is not at all infectious. It do have a tendency to run in the families. That means if you or your spouse has psoriasis, your children may or may not have psoriasis, but they have a more chance of getting psoriasis than the normal population. Now, psoriasis is something that can affect not only your skin, it can affect your scalp, your nails, and most importantly, it can affect your bones. So anytime you have bone pain and you have psoriatic patch somewhere in the body, and you go to an orthopedic doctor, please be sure to inform them that you have psoriasis in other parts of the body. So that will help the orthopedics doctor to come to a diagnosis. Because psoriatic pain and rheumatic pain in the bones are very similar. Unless you do extensive investigations in these cases. Anyway, what are the other types of psoriasis? Psoriasis can only be present in your palms and soles. That is called as palmopatous psoriasis. Sometimes it may present in the childhood, like it will have small lesions on your body following a bout of sore throat or any throat infection. That is called as gutted psoriasis. You can have something where you have large blisters and pus-filled lesions all over your body, or maybe in your palms and soles, which is called as pustular psoriasis. And most common psoriasis, which is found in the extremities, in the extensor part of your body, is called as psoriasis vulgaris. There is also something called as psoriasis, inverse psoriasis, which is rarely seen, which is found in the folds of the skin. We can have in the scalp, which is called as scalp psoriasis. Sometimes the normal people, they misinterpret this scalp psoriasis as normal dandruff. But you should go to a dermatologist and get yourself checked up when you have flaky scales from your scalp, which do not go away easily. And because that may be psoriasis, and that may be indicator that you can have psoriasis everywhere, other parts of the body. So you need to get yourself treated for that. Now, what are the causes of psoriasis? Causes of psoriasis and the triggers of psoriasis. We actually don't know what are the causes of psoriasis, but there are a lot of theories, and one of the most common theories is some triggering effect due to some infections or some super antigens. And one of the major triggers of increased psoriasis is any stress. It can be emotional stress, stress in your work, stress in your whole life. That can actually lead to increased psoriasis. And that may lead to something called erythema, which is a fatal thing, where your whole skin in the entire body, almost 90% of the body surface area, becomes red and the skin comes out of your body. There's peeling of the skin, scaling of the skin in the from 90% of the body. That is called as another entity, which is something that you should get admitted to the hospital for, which is called as psoriatic erythema. Now, most of the patients who come to us, what are the social challenges and the social stigma they face? Most of them, the patients, they tell us that because the lesions are very visible in the face, in the hands and all, they are very reclusive. They don't want to go out, meet other people because everyone start asking what is happening in their skin. Some people, they show that they are not very comfortable touching them or giving them a handshake because they have so many lesions in the hand. For me, it is very sad to hear such stories from the patient. But to all of you, you should remember this is something which is not at all infectious. It is not infectious. It is something that is inherited. It cannot be given from one person to another. It is not infectious. So you can safely go out. Obviously, you should get yourself treated. There are a lot of treatment modalities that are now given for psoriasis patients. You can give only ointments, moisturizers. Then we have some oral medications for psoriasis. We have something called as phototherapy, where the patient you take alternate B radiations to decrease your psoriasis. Now the major things nowadays we have lot of biologicals, which are injections or sometimes in depot formulations, which will make you feel that you are full disease free. You have to take injections once a month. There's so many options nowadays for the treatment of psoriasis. You should go seek a good dermatologist who has a proper degree and do as they say, do the test needed to for the medication, get yourself treated. Don't be recluse and not go out. And please, please, please don't go and take other modalities of treatment like Ayurvedic, Homeopathic, or go to see YouTube and take all the medications, all the other natural Ayurvedics and all those things that they advise because seriously they don't work. Please always go to a proper dermatologist and get yourself treated for such a big disease because this is a disease that you have to live with and you should have a proper knowledge of the disease. And this is for this psoriasis. Remember always that it is something that is lifelong, so you have to get yourself test regularly and you have to go to a doctor regularly. Don't stop your treatment in between because that may make you resistant to that particular kind of treatment. There are lots of support networks, lots of support groups for people with psoriasis. You can enroll yourself in one of them and talk out your problems, your social stigma. You also need some lifestyle adjustment that like bath in a no detergent bath, bath in a lukewarm water, moisturize your skin, and all these that will be told properly. You will be guided properly by a dermatologist. I hope this helped you as an overview of psoriasis and the importance of the quality of life. Hope to see you soon. You should find this video useful. Do go for more videos in the website DermaVidya.com. As a doctor, my advice for any skin and hair problems, please visit a dermatologist, a qualified dermatologist, and hear you. Thank you.
For more such videos, visit or log into dermavidya.com.